Those sedentary people, they will have a higher risk for a chronic disease like diabetes, osteoporosis.
最严重时我是不能上班。
有一度就是低头3个小时在写东西的时候嘛，就是我这个头这儿好多天我都不能抬得很直。
我有颈椎病，工作非常忙碌的时候会导致我的躯干末端会发麻。
Even for younger generation or younger populations, if they're doing office work and a really long time fixing in one position, it can cause cervical spine problems and muscle around your shoulder girdle problems. And also they can cause a herniated disc on your lumbar spine. Sports medicine have been the very booming careers in the medicine field for the past 2 or 3 decades. It directly links to the quality of life. I would say sports medicine was first introduced because of the professional athletes.
比赛结束之后，两个选手抱在了一起。
今天是跳水的第一个比赛日。
These professional athletes, whatever in the professional league or in Olympic Games, professional athletes, they are undertaking way more physical load than our usual people or our daily activity requires. For post-operative rehabilitations, for the same injury, for those athletes, they have better muscle and they have a better recovery abilities than you. So we have much more aggressive rehab programs for the professional athletes, but not for the normal population who have a sports injury. So that's very different. There's 2 major categories for the sports injuries in our population. Number 1 is in senior patients. The other category is in young people. Now they are more and more active than we were at their age. A lot of senior people, when they get retired, and they really like to enjoy the rest of their lives after retirement. When they retire, they have more time. They like to play tennis or even golf or even any kind of exercises. It can easily cause injuries because these senior populations may have pre-existed conditions in their body parts like rotator cuff in the shoulder or their degenerative changes in the knee for the meniscus or cartilage lesions already existed. So when they participate in new sports and new activities, that aggravates the symptoms. Regularly into sports, build that sports like a habit in your life is highly recommended for every people, whatever in a young age or for senior after retirement. You begin with a lower level of sports and gradually increase the magnitudes. That is very important. That's number 1. Number 2, you can go to a kind of specialist. They have what we call sports prescription. Sometimes that will be a recommendation from a doctor. And sometimes can be a recommendation from a trainer or a rehab therapist. It depends. So if you are just a normal without any chronic disease, you can go to a kind of a consultant to evaluate your body fat, your muscle volume, or your joint strength. Then they design a kind of a special program for you to begin with. This is very important, especially important for the senior patients. If you have chronic disease like diabetes or your high blood pressure, you have osteoporosis, then you need a more thorough or more detailed evaluations because sports prescription is supposed to be individualized.
我昨天晚上尝试了一下不用拐走的指步，然后晚上会有一点点疼。
为什么会疼呢？因为你的肌肉萎缩掉了。你一走路的话，这个肌肉受力了，受力就会
膝关节里面
4个月不去动它，肌肉都萎缩掉了。
多增加一些躯宽让的臀肌，帮你稳定一下力。
你在看电视的时候，其实就可以把腰椎就可以练了。
不爱动的人群，颈肩腰背痛、肌肉筋膜炎、肌肉力量不足这些东西呢，他也会碰到。碰到这样的时候呢，医生往往会告诉他，你要动哦，背部的这个肌肉都紧起来了，有筋膜炎了，有嘎啦嘎啦的这种沙粒样的这个声音了啊，其实他也离不开运动。
其实只要你动起来，就比不动好。站起来接个水，哪怕站起来走2圈，总比不起来好。
If you're a sedentary in life, I mean, I'm not blaming those people. That's the choice of life. But those people, compared with those who regularly take part into sports, they will have a higher risk for a chronic disease like diabetes, osteoporosis, and also for lack of vitamin D because you're not going outside for the sunshine. Then your bones are not strengthened. The intake of calcium is not as good as those who regularly take sports. Even for younger generation or younger populations, if they're doing office work and a really long time fixing in one position, it can cause cervical spine problems and muscle around your shoulder girdle problems. And also they can cause a herniated disc on your lumbar spine. Shoulder is very specific for the 5 major joints in the body part. The socket of the shoulder we call the glenoid is very small. It's like a coin. So that means they have the maximum range of motions, mobility of the whole joint, the shoulder. So the stability of the shoulder is not supplied by the bony confinement. It's by the soft tissues, the capsules, the ligaments, and the muscle around them. There's 2 common injuries, sports injuries for shoulder. Number 1 is the recurrent dislocation. That is mostly happen in the younger population with an uneventful force within an external rotation and extension, and the humeral head pops off. And when you reduce the joint, the torn tendon or the torn capsule, they does not automatically come back. So there's a defect there. Then later on, you have the same location with external rotation in abduction position. Then there's the most important stabilizing factor is gone. It come out again, so we call recurrent dislocation. The other common injury is rotator cuff. Those pathologies are mostly found in senior patients. The shoulder joint is different than any other joint because they have a cuff we call rotator cuff. It comprises of 4 muscles. The supraspinatus on the top, the subscapular is in the front, and infraspinatus and anterior minor on the posterior part. So these 4 muscles is like a cuff covering the whole shoulder joint. These are the major stabilizer, number 1, and also the major dynamic moving muscles to make the shoulder function as a very good thing. If your rotator cuff torns or dysfunctions, when the major abduction muscle of deltoid, when they function or contracts, the humeral head only goes up. It does not rotate. So it's like doing this. In a very massive shoulder rotator cuff injury patients, we call a pseudoparalysis. Rotator cuff tear is a normal aging process. If you're senior enough, you'll have a very high occurrence of the rotator cuff degenerative changes or even tear. Only some of them are symptomatic. I would say quite a bit of doctors, when they see a MRI images, they say, oh, there's a tear, we should operate. No, that is totally wrong. You need to couple what you have, the clinical examination, then couple with your image all together and inquire about the patient, their need, their symptom. This is a comprehensive evaluation to make a decision whether you need surgery or not. Only the X-ray or MRI showing a tear would never be an indication for surgical treatment. And then combining your lifestyle.
脑袋有点胀胀的，那这样会影响你左右转头活动度之类的吗？
有时候有一点，
有时候有一点。
但是我才56，后面的生活的质量实际是我比较关注的。
OK。
You're a sedentary people, or you're really active in your life, we combine all together, then we talk to the patient whether you want surgery or not. Maybe you need it, you want to play tennis right away, then we can be a little bit more active in the treatment. If a sedentary 70 years old retired housewife, she never played any games for the past 50 years in her life, and she just want to have no pain during sleep, you cannot universally give recommendations to every patient. You need to be individualized according to the pathology, according to the characteristic of life of the certain patient. It's always a combination of a comprehensive evaluation. You have to help the patient not only anatomically or surgically, but also economically and also psychologically. Sometimes you cannot decide for your patient. You're not them. You have to communicate them. You list all the pros and cons with them. It helps to decrease the misunderstanding between the patient and the doctors. But if you can help this group of patients, you'll save a shoulder, you'll save a life, maybe you'll save a family. These patients, some of them come from poor families. They came from remote countryside. You can bring them back to their job, work, to raise a family, to raise themselves. You're not treating the patient itself, you're treating a family together.
再往下，慢一点。
再往下，
对，好，再来。
酸酸胀胀。
久坐不是问题，久坐不动才是问题。
Do not stay at your table more than 45 minutes or an hour. That is not good for you. Not only the cervix spine, not good for your shoulder girdle, not for everything. Every 45 minutes or an hour, you should move. You have a hunchback, move your shoulder, move your chest, and stretching, and make that happen. If you keep your muscle in a hunchback here for a very, very long time, you must remember that position. Even if you're not working at your table, you tend to have that kind of position. So the key thing is to break that habit. Do not let your muscle have that bad memory. And also get into an active life, get into sports. That helps a lot.